Everybody, in this short video, we're going to be talking about some general information that you need to know about epinephrine when it is given as a medication. Basically, when epinephrine is given as a medication, it is dose dependent, meaning that at low dose and medium dose, it is mostly affecting beta receptor, beta 2 receptors in particular, and it is causing vasodilation. And at higher doses, it is mostly affecting alpha 1 receptor, leading to vasoconstriction. So this benefit or this characteristic of epinephrine can be used in our advantage when we need to have beta 2 activity or alpha 1 activity. And epinephrine is basically a catecholamine, therefore it cannot be given orally, so it is given either by IV or subcutaneously. Another thing to keep in mind is that epinephrine is a subset of both monoamine oxidase and catecholamin-methyltransferase, so it has a very short duration of action. Now let's come to the common uses of epinephrine. When are we using epinephrine in the field of medicine? Epinephrine can be used in the treatment of bronchospasm or anaphylaxis and anaphylactic shock, which is the most severe type of type 1 hypersensitivity. It can be used in the treatment of glaucoma. It can be used in the treatment of cardiac arrest, or it can be combined with anesthesia in order to increase the duration of the anesthesia in question. So what are some common side effects of epinephrine? These are side effects, by the way. Epinephrine may cause CNS disturbance. It may lead to arrhythmia, or epinephrine may cause hemorrhage, so you should consider this. So what does epinephrine do to heart rate, to total peripheral resistance, to the systolic blood pressure, or to systolic blood pressure? Basically, when you are given epinephrine at low dose or medium dose, we say it is mostly affecting beta 2. So when it is given at these dosage forms, it will increase heart rate and it will decrease total peripheral resistance, because beta 2 is leading to vasodilation, and the vasodilation will cause vasodilation-induced tachycardia. And what about systolic and diastolic blood pressure? As we all know, systolic blood pressure is mostly affected by cardiac output. So since heart rate increase, cardiac output will also increase, so systolic blood pressure will increase. What about diastolic blood pressure? Diastolic blood pressure is mostly affected by total peripheral resistance. So if total peripheral resistance decrease, then diastolic blood pressure will also decrease. This is all that you need to know about epinephrine generally. Thanks for listening.